All right, I see it's 12 o'clock. Shauna, are you ready to get started? All right, good afternoon, everyone. Welcome to the 5th program in our Lunch and Learn series at the clinic. Today, we will be learning all about pragmatics. We have 3 more presentations after today, always on the 2nd Wednesday of each month. On April 13th, please join us to learn about empowering meaningful communication with AAC and overcoming prompt dependency. That will be presented by our SLP, Adrienne Koenig, who you may remember from our first Lunch and Learn focused on echolalia and Gestalt processing. She was so wildly popular that we had to bring her back for more. I am very pleased to introduce psychologist Dr. Amy Zarkowski as today's presenter. Dr. Zarkowski is the director of the clinic as well as the institute at the Children's Center for Communication, Beverly School for the Deaf. She is also faculty in the LEND program, Leadership Education in Neurodevelopmental and Related Disabilities program at Boston Children's Hospital, and holds appointments at both Gallaudet University and Harvard Medical School. She is a renowned expert with vast experience supporting children and families, an extensively published scholar, and she happens to be a genuinely nice and wonderful colleague and person. Today, Dr. Zarkowski will be presenting about the very important topic of pragmatics, social communication, and its role in development. Today's presentation will last approximately 30 minutes, and we will leave around 15 minutes at the end for Q&A questions. Please do use the chat to interact with other participants or make us aware of any issues with accessibility. And use the Q&A to pose any questions that we will address at the end. And now I'm very happy to pass it off to Dr. Zarkowski.
Thank you for that kind welcome. It's a pleasure to be here and have the opportunity to share with the audience some information about pragmatics. Okay, so welcome to this Lunch and Learn. As we mentioned, we are doing these on the 2nd Wednesday of each month during the academic year. If you have not yet had the chance to participate or observe the Lunch and Learn sessions, they are available on the website for the clinic, and you can go back and watch them there. And then also here is listed the upcoming sessions that we'll be offering. So let's get started. Today's topic is interacting with others, the art and science of pragmatics. Sarah offered a kind introduction, so I don't need to say a lot about myself. I was just going to iterate that I am the director of the clinic. I'm a psychologist, an academic and an author, and also I bring to this work my roles as a mom, as a woman, as a human being. I have strong feelings about why we use language, and I think that it's really important to use language in order to connect with others, to make ourselves understood, to help understand others. I think that so much of the reasons that we use communication, language abilities is really in this area. I am going to be sharing a resource document about a week or so after this presentation. On our website will be a resource document with links and other things, as well as this recorded video that you can access. There, I will include all of these papers that I'm going to be referencing during this presentation, so no need to take notes unless you want to. This presentation draws heavily from a supplement in the Journal of Pediatrics that was published in November 2020. I had the privilege of working with other scholars to help really explore this topic of pragmatics in children who are deaf or hard of hearing. So here are just a couple of the papers that are listed, but the supplement as a whole includes 12 papers that really focus on this topic of pragmatics with children who are deaf or hard of hearing. Now, today's presentation is a little bit different because it encompasses both children who are deaf and hard of hearing, as well as children who have complex communication challenges or needs. So really both of those audiences are what we're aiming to talk about today. There are lots of different views about pragmatics. One of the things I find tricky and interesting is the ways that different professionals from various disciplines have looked at and described pragmatics. Here are just two examples out of many. In terms of language, people who are language folks, like speech language communication people, might think about pragmatics in these ways as a part of language where it sort of builds on itself. So like phonology is the sound that letters make. So this view, you don't need to know what all of these terms mean, but just the idea that you go from sort of sounds to words to bigger chunks to understanding meaning. And then pragmatics is described a little bit as sort of once you've achieved those things, then you can apply them in a social way. Another lens or another view of pragmatics is the cognitive view. And in this way, people who study cognitive pragmatics think about things like intention. How do we know other people's intentions? How do we make inferences? So that's like understanding something that isn't exactly said. Perhaps I might say to my child, the ice cream's going to be melting in the car, suggesting maybe they should help bring the groceries in. I'm not actually just making a comment about ice cream melting in the car. I want them to do something with that. So that would be an example of an inference. Cognitive pragmatics also looks at metaphor and irony, and it's sort of that level of thinking about social interactions. What's important about pragmatics for children who are deaf or hard of hearing or who have complex communication needs? For this group, I think we need to think about reconceptualizing pragmatics in different ways. What we know from the literature is that pragmatic development actually begins before language. When we think about pragmatics as the ability to interact and socialize well, then there's a lot that happens pre-linguistically that's worth paying attention to. Pragmatics is impacted by language. If a child has limited language for a variety of reasons, that can impact their ability to use the language they have to connect with others. However, it's not dependent on language exactly, because there are children who have limited language repertoires and yet are really savvy at using whatever language and communication skills they have to make or help others to understand them rather. Right? They might use, even if it's a very small vocabulary, they might use that in a teasing way. They might be able to use that to say more, indicating like you're giving me too much, right? There's lots of ways you can show pragmatic understanding even when language is limited. So there is definitely a relationship between language and pragmatics. But really, we're thinking of it in terms of pragmatics being this overarching idea of how we socially engage with others that kind of includes understanding of words and understanding of grammatical structures, for example. Okay, so pragmatics we might think about as communicating with and without language in the traditional sense. So it's not just a matter of more vocabulary, higher level language ability, higher pragmatics. That's not true. Pragmatics is using communication in social contexts to achieve shared meaning. So it's hard to measure pragmatics. Turns out, as we sort of investigated this with this group of scholars that I worked with, that it's not one thing, right? Because pragmatics, to use your communication abilities in social contexts, means communicating with peers, communicating with close relations, like maybe the way you converse with your family is different than outside of your family. It involves being able to speak to people who have different levels of authority, like you might speak to your parent differently than you speak to a teacher. There's so many ways in which pragmatics comes into play in how we connect and engage with other people. I think a really important point is this idea that early relationships really lay the foundation for pragmatics. And the reason that I sort of took us through those slides to say pragmatics is more than language only is to say that all of this stuff happens again before language, formal language is happening. We know that caregiver responsiveness to the child really helps a child to know, oh, when I make a sound or I do a face, then my caregivers respond to me. That develops a sense of agency, right? That if I am a toddler and I make a funny face, and each time I make that same funny face, my caregivers look to me, they smile, they encourage me. I then have learned a trick to help engage them, right? And that's a kind of knowledge that's really valuable in social exchanges. Attachment is another thing we think about. Attachment is that bond between typically a parent, but other close caregivers could also be involved. That bond between that parent and that child. Children who experience secure attachments kind of know my caregiver is going to be there for me, right? They might not come every time I cry, but when I have the cry that indicates that I'm hurt, they recognize that cry and they will attend. Right. So the child building confidence to know that when I emote or engage or show something that's going on in me, then I'm going to get a response. Interactive play is another way that we lay that foundation for pragmatics. And that can happen very early. It can be just turn taking of sticking out one's tongue. Right? Baby sticks out the tongue, parents do it too, and it becomes reciprocal. Right? Serve and return, as it's sometimes called, the idea that when I offer something up, that person responds in kind. I'm sure if you're a professional, if you've worked in this field, you may have encountered children who have difficulty with turn taking. Those children may be incredibly bright, they have very strong language abilities, but a child who's unable to take turns once they reach a certain age does tend to have difficulties with their social engagement with peers. Right? The ability to turn take really is valuable in helping to build other relationships. Okay, so this is just a picture that shows a little bit about what we're talking about with caregiver and child and how they can use shared reference, right? This idea that if, in this case, let's call this a mom. So we got a mom and a child and they're looking toward each other. If the baby looks away, the mom also looks away. Oh, then we understand that there's something that's in our environment. We're really sort of in sync with each other. If we're looking toward the toy that you see on the slide, if the child looks to the toy, looks back to the caregiver, looks to the toy, the caregiver, there's an intent there that the caregiver is supposed to look to that toy too, right? So that's just an example of a very young child kind of having agency in this relationship between baby and adult, where what they do is directing the adult to meet their needs. Right? By looking to something, looking to the adult, looking back at it. When the adult then follows suit, the baby says, oh, you get me. You know what I'm looking at, you know what I'm interested in. Right? When an adult doesn't respond in that way, then the child may have bigger actions. You may see more behaviors that result if their child isn't receiving kind of that back and forth that they expect and hope for from the parents or caregivers. So I offer this as an example of a way that babies, even very young babies, direct these social communications between themselves and the people in their worlds. definitely an old-fashioned view that the parents or caregivers are the ones who are just teaching language and teaching the child to do these things. The child has a significant role in this as well. And you'll notice that none of these examples that I've provided involve signs or words or formal language, right? Because again, these things take place prior to the development of formal language abilities. So we want to make sure if we're working with young children who are deaf or hard of hearing, or who have complex communication needs, that we're really helping parents, families, caregivers to do this kind of connection early on, which can lay the foundation. As a psychologist, one of the things I worry about is that sometimes a caregiver will kind of wait until the child is producing signs or words or using a device to show what their language is before they start really engaging in thinking that the child can communicate reciprocally. So I think pointing out to families and families themselves recognizing my child is communicating in all of these ways prior to formal language. It's really important because that brain starts developing from day one. As children grow, so do the pragmatic demands on them. That we just had a picture with infants, and their pragmatic demands were getting adults' attention with their eyes. But as children get to be toddlers and preschoolers, where you start to see things like pretend play, right? This might not seem like communication necessarily to some people because it might not involve, again, words or signs, but really this idea that I have an understanding of the world and I'm going to manipulate the objects in my environment to help show you what it is that I'm thinking. Those are all foundational building blocks of pragmatics. Children who are very young can understand intentions of others. You know, when their 2-year-old classmate at the nursery school takes a toy and hides it behind their back, oh, I think that they want to keep that one. Maybe they want me to find a different toy. Interactive play helps us to understand what the child is actually understanding also about the world. These ways of playing with children, both amongst themselves and with the adults in their world, are really important for helping children to grow that idea that what I do has an impact on others, and I can get others to engage with me in certain ways by using my pragmatic abilities. Right? Okay, so we've focused a little bit on those younger kids. Now I want to talk a little bit about how pragmatic demands change as children get older. Some of the research in this area links these developmental milestones to certain ages, and so we could talk about that. But I also want to be really mindful that this population of children we're discussing, children who are deaf or hard of hearing, and children with complex communication needs, they may have a slightly different trajectory. Right? So that their language might be developing rather than this, it might be a little bit more like this. So we just want to think in terms of early, middle, and late. What are those pragmatic demands as children age? So early on, things like inviting others to play. Maybe that just means your turn, offering something to somebody. Children also need to be able to tell a truth from a lie. This is an interesting thing because sometimes parents think they don't want their children to lie. And certainly if your child lies to your face, that seems like it's a very offensive behavior on their part, right? However, that's actually kind of a savvy thing that children need to be able to say, oh, here's a person I can tell the truth to. Here's a person I might hide the truth from. And being able to navigate them, that helps them to understand their social world. They might also need to keep a secret that grandpa's surprise birthday party is coming up. And so to be able to not tell that is a sophisticated level of pragmatics. All right, moving on to the middle section. So as children get a little bit older, things like politeness, knowing how to change your register. We talked about the difference between the way you would communicate with a family member versus a teacher. That's part of pragmatic abilities. Persuading others, if you think of the elementary school student who's able to convince other people to play what they want to play on the recess field, that might be an example of that. And we definitely want to have things like humor and sarcasm are really important ways that people navigate social interactions. That's all part of pragmatics too. Negotiation, well, I really want this, but last time we did what I want, so I guess this time we can do what you want. Those are social skills that really help children to be successful with their peers and others as they grow. All right. Why might pragmatics be an issue for children who are deaf or hard of hearing or have complex communication needs? So far, I kind of think that much of what we've discussed applies to all children. That children, regardless of what language or languages they are picking up, they benefit from these ideas, these strategies for thinking about how do I use what I know about communication to engage with others and help them to understand what it is that I need. But I think that there are some things that are specific to children in this group, children who are deaf or hard of hearing or have complex communication needs. The research suggests that children in this group often, not always, sometimes have reduced formal language. We know that some children who have complex communication needs or are deaf or hard of hearing may have some language delays, depending on what their early access or exposure was like. Related to that, there might be some delayed social cognitive developments. So if I'm understanding how to use language to be persuasive, for example, if my language abilities aren't quite there, it's going to be hard to use that language for that specific purpose. Now, if you're a professional who is working at a school and you happen to have the child in your classroom or on your therapy schedule, and there's not much that you can do looking back or going fixing or changing or doing something different about their early experiences. But sometimes it can be helpful to think, if you're working in early intervention or you're working with the little people or you're working at the preschool, how can we make sure that we're building on these now? Because it's not inherent that children who are deaf or hard of hearing or have complex communication needs will have delays or challenges or reduced language. Please know that I'm not stating that that is true for all. It is, unfortunately, the lived experience for some children who have not had the benefit of early exposure to consistent natural language that they may fall into that category. Children who are deaf or hard of hearing or have complex communication needs very often have fewer communication partners. This may not be because they are not social or they don't desire to have communication partners. It really might be that there are not as many people who have either the sign fluency or the AAC proficiency or the ability to just communicate and engage at the level that the child needs. The fewer communication partners that any of us have, the more limited is our repertoire of how to navigate those social situations. There are fewer opportunities for children in this group to have natural conversations. What I mean by this is the idea that the children are instigating or initiating conversation, that they're conversing about whatever it is that they want to talk about. The TV show that they watched last night, the upcoming activity that they're going to do with their family this weekend. Sometimes children who have quote unquote reduced communication abilities are a little bit more adult driven in their communication exchanges. It might be that the adults are asking questions and expecting responses from children. And children may develop a way of engaging in social interactions where they wait for that. They wait for the adult to ask the question and they respond. Or they may take over a conversation because it feels more comfortable to know, if I know what the conversation and the topic is, then it might be easier for me to lead this conversation. So that might be a pattern that we can see as well. Certainly there's information in the literature about incidental learning. This is the ability to just pick up on information that's happening in your environment, right? In many classrooms, a teacher could provide guidance or feedback to one student, and other students might either overhear that or observe the teacher doing that, and then they kind of quote unquote learn that lesson too. It can be harder for children who are deaf or hard of hearing to just pick up on those conversations, those side conversations. And for children who use a device or have other complex ways of communicating, it can also be difficult to know, how does that conversation or exchange apply to what it is that I'm doing in my communicative efforts? So I want to point these out, not to say that these are things that all children will struggle with, but rather to challenge ourselves as perhaps parents or caregivers or professionals who are supporting these children, to say, how can we make sure that we're doing our best to minimize the impact of these factors on the children we work with or we're raising, to help grow their pragmatic abilities. So I want to leave us with that, to say, how can we, as parents and professionals, help? It is my hope that through today's very brief presentation, you've learned a little bit about what pragmatics is, why we think of it as kind of the soup we swim in, rather than something that we achieve or we can check off on a list. And that you've had the opportunity to think about the young people in your life, whether those that you're raising or those that you're supporting through your work. How might pragmatics be impacting them? And how can we help grow those abilities? There is a lot of benefit to having strong pragmatic abilities. And if we put our energy and some focus there, the benefit to both the child and all of those that they interact with can be quite positive. In a moment, we'll go to the questions and answers, but I did want to just say, if you're interested in contacting us at the clinic, there are different ways to do that. We would look forward to engaging with you. And with that, I will stop sharing. And invite your feedback or comments.
Thank you so much, Amy. In just a moment, I will put in that contact information into the chat. Feel free to use this time to put questions into the chat or into the Q&A. I know there's a lot to take in, and sometimes we need a moment to think of or pose those questions, but I was just reflecting. I was trained in linguistics, so that list you had on an early slide of the language pragmatics and the phonology and phonetics and syntax and semantics, that was sort of the training that I had. And pragmatics was sort of like the thing you get to at the end. So it's nice to reflect on, that's really not the way things develop, that we're, use the phrase, the soup we swim in, which is very visual from early infancy. And I'm also reflecting as a parent of a 12-year-old, there are non-linguistic ways of communicating, such as eye rolling and sighing and stomping up the stairs, which are ways we can all communicate our thoughts, feelings. That's a big one for us right now. But I'd like to invite folks to pop those questions in if you have areas you'd like to discuss a little bit more in depth. Well, we have Amy here as our expert.
Just to build on your comment, Sarah, in addition to the nonverbal eye rolls, there's also the inference that one can make when you hear mom, which is very different than mom or mom, 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 all of which can be heard at my house.
Yes, indeed, absolutely. We have a pondering group today, thinking of questions. I wonder if you might speak about what led to the work, with the, not culmination because the work is ongoing with the supplement, but what led to the Pragmatics working group and sort of where the backgrounds maybe and how that came to be to support this work that you've undertaken.
Yes, I previously worked primarily full-time as a clinician with children who are deaf or hard of hearing. And what I and my colleagues at the time were seeing a lot of was this idea that children were making progress in their language development. So they were getting assessments of their communication abilities and they were making progress and sometimes, doing so well after early intervention that they weren't qualifying for services as they entered into school, or children who were older who were scoring really well on those but struggling socially. And thinking, what is this? Where's this gap? Where's this breakdown between these strong communication abilities and these pragmatic skills that are causing difficulties for some kids? And so I was really fortunate to be able to receive some funding from the Radcliffe Institute at Harvard and brought together people to ponder this and think about this. And then there was some subsequent work that came out of that, an additional workshop that helped us to say, this is something that a number of people were seeing and wanting to understand it better. So it was thrilling to have the opportunity both to work with eminent scholars and people who know much more than me, and were able to then produce something that could make a contribution and hopefully help us to understand pragmatics better and make us all better at addressing it.
Interdisciplinary expertise all coming together. It's great. Yeah. All right, we have some questions coming in. We have a comment. Thank you for this great presentation. It really got me thinking. I am wondering if you might speak to some ways that cultural differences play into pragmatics or any advice for navigating that. Has the field of pragmatics explored neurodiversity and how to support pragmatics while respecting cultural differences?
Such a good question. I'm going to answer that from a couple of different ways. So one is that absolutely within different cultures, there are different ways that people use pragmatics. And certainly in different cultures, it might be appropriate to have eye contact with somebody the whole time that you're looking at them versus another culture where if you're a younger person, you should never have eye contact with an adult. There's lots of ways that cultural norms guide what is appropriate for the pragmatic expectations in a given culture. I also think it's important to mention the idea that there are deaf cultural pragmatic norms that are strengths, right? So certainly, although I have a slide on here that suggests we need to be looking out for areas that might prove difficult, the research also suggests that, deaf people who are culturally deaf and use signed languages do a really nice job, for example, when somebody joins a conversation. So if you have a group of folks who are standing here and they're conversing and another person joins them, they tend to do a really nice job of providing some context and including people in conversation. So I'm not at all suggesting that there are groups of people who have lesser degrees of pragmatics. The pragmatic challenges can be different. For young people who are deaf or hard of hearing and navigating both of those worlds, maybe they go to a school where pupils are signing and it's sort of a deaf cultural environment, and in a home setting, for example, maybe they're using spoken language. Those children have to learn the pragmatics of both of those ways of conversing and also kind of the cultural or expectations and norms for each of those environments. So it's very possible that you could have somebody who has real pragmatic strengths because they're able to navigate different kinds of worlds. Now, with respect to children who might be considered neurodivergent or who have autism. One of the markers of pragmatics, let me back up. One of the markers of autism or autism spectrum disorder is difficulties with pragmatics. In the clinical role, it was not uncommon for me to have the question raised, does this child have autism, or are there pragmatic difficulties because the child is deaf or hard of hearing, right? So teasing some of that out can be tricky. But I think there's definitely this idea around what are pragmatic strengths of individuals who have autism, and whether and how we want to support them in addressing any pragmatic challenges might really be influenced by what's important to them, right? So rather than saying all children need to do this pragmatically, for some children who are on the autism spectrum, that might be a difficult thing to do. It might be more appropriate to say, in which contexts do you feel like you would like to improve those, your social skills or your social interactions with people? And maybe those can be targeted with support.
That's a great question. Another question that came through the Q&A, for a child with limited ability to access language, who also has difficulty at times sharing in visual cues and experiences with others, what are ways we can increase pragmatic skills at home?
There's a lot of factors there, right? So if you know the specific child, it can offer more specific advice. But I think this idea of making sure some of those foundational basics are covered, like turn taking, like if I want somebody's attention to something, what are ways to do that? So a child who just pulls on a parent's sleeve all the time might get a parent who turns around and is frustrated. So how might you in the home say, what are different ways to do that, right? How can you get my attention without bothering or upsetting me? Or figuring out as a family, what are the ways that turn taking, reciprocal interactions can happen? Another thing that I didn't talk a lot about today is sort of this idea of mental states. And if I'm a parent and I'm saying things like, I am feeling frustrated because I'm giving some insight into what my feelings are, right? And that can help children to say, oh, frustration for my mom at least looks like this. Frustration for my other caregiver might look different. Those kinds of things where we just give some insight into what it is that I'm feeling, what it is that I'm thinking, what are my beliefs. Even I'm worried about X, Y, or Z. Oh, then that helps the child to understand why you might be responding in a certain way. Those are just a couple examples.
Great. We have a question about complex communicators and assessments, thinking about if you have recommendations to have data to make the best choices for communication methods, such as AAC versus core, PECs, etc. I would encourage this person to also think about coming to our next Lunch and Learn, because that will be led by one of our speech language pathologists who will be talking about AAC and how we can reduce prompt dependency in individuals who use AAC. So that might be a great place to have some of those questions addressed, but I don't know, Amy, if you have any other comments about that.
It's beyond the scope of my expertise to say, specific things about devices or techniques for communication. But here's what I will say is that anyone who's in charge of or charged with helping children to develop their communication abilities, it's really important that children have the ability to say, not just respond to adults or caregivers, but to initiate, to offer their real responses. So not just the expected, how's everyone today? Oh, fine, fine. Or I use my device to be able to say, I'm fine, because that's what's expected. So it becomes a routine or rote exercise in responding. If we center pragmatics and think of pragmatics as really encompassing communication language as well as exchanging, I think we can make better choices about the kinds of devices or supports that we use with children.
All right, we have a question. Are there other resources, future workshops, etc., that you would recommend for strategies and interventions to address pragmatics?
Yeah, I would say watch this space. I think part 2 of something that, an early presentation that defines pragmatics, and then having another one that comes later around what to do about pragmatics. I think that would be in order. If you have specific interests, there are resources on the website, and we will share out those publications about this topic. There are papers that have been written that are part of this collective that suggest specific recommendations depending kind of on the age of the child. So there's some looking at infancy and looking at early childhood, and then older children and adolescents. So those are some resources. I do have some opportunities for conferences coming up where I'll be talking a little bit about pragmatics. So you could certainly contact me and I could share those with you if that's of interest too.
You mentioned in a week or so when the recording is available, we'll have a resource list as well. Maybe we can put those on there. I'm going to put a link here to a pragmatics, a web page on our website focused on pragmatics that might be of interest to you. I'm also going to put in our link to our Facebook. So please follow us on Facebook, because if we have events, even if we are not necessarily sponsoring the event, but it's something that's of interest to those who are our audience at the clinic, we try to highlight those on our social media. So if you follow us there, we encourage you to do that. That will be available to you. I don't see any other questions, but I have one. Okay. You spoke about that some deaf or hard of hearing children may have limited access to natural conversations and language that may impact their pragmatic skills. I'm wondering about the children deaf, hard of hearing, or hearing who do have full access to language. Might they also face issues with their pragmatic development? And what are some of the things that we might do to recognize those issues and address them?
Certainly, there are children who are hearing and who have no difficulties accessing language, who have pragmatic difficulties. As psychologists, one of the things that we can diagnose is social pragmatic disorders. Mm-hmm. So that certainly exists. What are the causes? That can be tricky to discern. For some children, it can just be tricky to say, I look at your face and I see it moving, but I don't get what that means, right? Mm-hmm. So depending on the age of the child, it also might be really important to teach those things, like, the faces that you often see, that like emoji faces, when they show anger, they show, something coming out of your head and you look so mad. And that might be the image that children have, and they associate that with anger. But for many people, myself included, when I become angry, I might get quiet, and I might not look at all like my head's going to explode. Mm-hmm. I might look like, And in fact, I've had my son tell me he can tell that I'm angry when my nostrils get big, because that's my telltale. I think helping children to understand real emotions, right? Mm-hmm. And for children who have more limited access to language, we might not think about putting the energy and effort into that piece. Mm-hmm. We might limit ourselves to thinking about, are you mad? Are you sad? Are you happy? And not going much beyond that. But there's a lot more to emotions and to nuance than that. Yeah. So those are some things you could work on as well.
There's probably a lot of conversation that will be happening regarding the several years of masking and the limited access to full visual access to the face that we may be seeing coming out of this time.
Yes. Luckily our brains are able to fill in a lot of things. And so there's some evidence to say the impact isn't so great. However, I read a paper yesterday that talked about how children who grew up in their 2s and 3s through this pandemic time are experiencing significantly greater difficulties with language, and that these are not children who are deaf or hard of hearing. So there seems to be a cohort of kids who have been impacted. And perhaps if you imagine the 2.5-year-old who's at home, whose parents are trying to work well on Zoom, they're being told shh, 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 a lot, as opposed to let's get you talking and engaging and sharing as much as you can.
We can be grateful for the opportunity to recognize the role of pragmatics in development, not at the end, but throughout from infancy and share these resources and kind of spotlight and highlight the role of Pragmatics for children.
I want to thank you so much for coming and sharing your lunchtime with us.
Also like to thank Shauna and Jenna, our 2 interpreters today, for providing access. And we hope to see you at our next Lunch and Learn next month. Thank you, everyone.